Hi guys, welcome back to another video. If you saw my most recent video, you saw that I had surgery on my leg. And from there, I was waiting for the results from the lab about the biopsy from what they took out of my leg. And I was waiting for the stitches to come out. Since then, I went into the appointment expecting, okay, stitches coming out, bandage coming off, lab results. It was a very fast appointment, like 15 minutes. And the good news is, the biopsy came back clear. So it was a benign tumor, a glioma, and from what the surgeon was describing, it's basically all the blood vessels have smooth muscle surrounding it, and it was basically a growth of that. But since it came back benign, they don't have to worry about it coming back. So that is good. I'm definitely grateful for that. The stitches did come out, but I did leave with another bandage on top of it. Originally, the medical assistant was going to be the one taking out stitches, then it'd be good to go. But after seeing what the scar looked like, the surgeon said, there is some scabbing there. There is some kind of reddish, he said, dusky color around it. So he wanted to stay compressed for another week. He did recommend being sedentary for another week. I think by now you know how that went. He didn't even ask about whether I had been sedentary or not for the past couple weeks, but based on that, he did want to stay compressed a little bit. He also put steri strips on it to keep it covered, to allow a little bit more healing and to keep the skin a little closer together because of the scabbing. So I left with another bandage. He said to keep it on over the next week as the steri strips come off, to cut them until they can fully be removed and were falling off themselves. And then after that, for about a month, I should be using a cream to help with the scarring and discoloration around it that is typical with lower leg surgeries because of the iron in your blood and the amount of movement that goes on with lower legs. So since then, for the next week or so, the steri strips actually stayed on really well. Even though I was still working out, I kept it wrapped. I think honestly, the most annoying part of it was the itching from the bandage itself and not the actual scar. Every so often there were some twinges just around the scar, but when it was compressed, the scar felt fine for the most part. It was the itching from that adhesive property in the bandage. And that was the same issue for the first couple weeks when I had the stitches as well. It was mostly the itching from it. Steri strips started slowly coming off themselves. They did last actually a little bit more than a week. As you can see, it's still pretty scarred. It was a relatively small incision, so it doesn't look like a lot. There is more bruising and some soreness around the area now that the bandage is not on there compressing it. I do feel that more, especially by the end of the day. So what I've been doing is working on the skin surrounding the scar and pushing some of that fluid up my lower leg, around the scar, and then also doing some gentle, what we call scar mobilizations in physical therapy terms, that I've taught a lot of my patients how to do that post-op, especially when the stitches come out. And now the steri strips are gone, I can do that. The cells are basically running parallel and smooth, and then when they're scarring, they're just kind of all over the place and messy, and the skin does not move as well. So that's what we do scar mobilizations for, to gently break apart the scar tissue and get the cells back in line with the rest of the ones that weren't compromised during surgery. Now that the bandage is off, I have started putting the scar cream on it twice a day. With the scabbing that is there, is it likely that part of that scabbing is from my physical activity? Yes, absolutely. I completely 100% own that. It might have healed a little bit tighter with less of the scabbing if I had been sedentary for those few weeks. However, personally, I would rather deal with the scabbing, do some scar mobilizations, have a scar there, and work on that over time than to not be able to move or do anything for those few weeks. That is my personal preference. Yes, it is sore and it's still tender around that area. I can still see a little bit of inflammation around there, but bottom line is I would rather be able to gently work through that over time and still be able to maintain my lifestyle and push toward my goals than to take 2 to 3 weeks off and then be further set back in terms of my goals, in terms of my my fitness, cardio, etc., and have to work harder towards that, even if the scar was okay. Again, that is different for everyone. So that is what I chose to do. I'm still doing Stairmaster for cardio. Now that I've been doing it for a while, I actually found that my calves are not as sore and tired as they were when I was doing all of the incline walking for 40 minutes. And I could still get the rest of my steps in at home. During a recent leg day, I did actually try the glute med kickbacks. And it was strange, honestly, to do the glute med kickbacks and not feel pain. Nothing that I just had to grin and bear it through the exercise. There's no bump I have to worry about. There's no pressure, nothing. That was actually nice. Like, wow, I can do this exercise now, and this is what it feels like to not be in pain. So that's been great. It's still a novel concept for me. And in other news, we are going home to the Bahamas. It's actually been about 6 months since the last time we were there. So we're going back for a little vacation, and I can't wait to share it with you. But in the meantime, I have to go pack and get ready for this trip. So I will see y'all soon in the next video. Thanks for watching.